All right, it's a pleasure to have you join us today on the program, Healthy Living. I am Adesuwa Osa Owage. It's been a wonderful month since we are almost ended it in a couple of hours. And it's been the month to create awareness on breast cancer world over. And in Edo State here, we are not left out, as the Medical Women Association of Nigeria took their turn to make sure that people are enlightened. If you're not comfortable with the word breast, maybe you should close your ears, because what we are doing here is serious business, and what we want to talk about today is serious business. It may sound ordinary, but breast cancer is one thing or one disease that kills women faster than you think. Why? Most of them will not go to the hospital. Some will go and will not go through proper medication. Others will go, but because of one meat or the other, they would not want to take care of themselves. And another thing is poverty. And there are so many mysteries surrounding this issue. And I have two female doctors here who are going to be demystifying a whole lot about breast cancer. And the number to call us on is 052-290-573. Do not call us on any other issue if it's not breast cancer. So join me as I welcome the President, Medical Women Association of Nigeria, Edo State Branch, Dr. Lucy. Everybody, it's nice to have you join me.
Thank you very much. Good afternoon.
And seated beside her in blue, looking gorgeous, is Dr. Mary Ehimigbai. She's the Secretary General. You are welcome, Dr. Mary.
Thank you very much.
All right, ladies, we are looking at breast cancer. It's been 1 month of full activities trying to enlighten the public about breast cancer, both men and women. And we've come to realize that it's not just women that can go down with breast cancer, men too. So, but before then, ladies, let me come to you, Dr. Lucy. Breast cancer, when we say breast cancer, what are we looking at?
Breast cancer is actually a growth, an abnormal growth in the breast. We would define it as an uncontrolled growth.
Uncontrolled?
Uncontrolled growth in the cells of the breast,
okay,
which will actually begin locally and can have tendency for spread,
okay,
which
when
we call
you say begin locally.
Metastasis.
Okay, when it begins locally, can
it
you
begins
break
in the
it
breast.
down?
It begins in the breast.
Just the breast?
It starts in the breast, and if not treated, it now begins to spread to different parts of the body. It can spread from head to toes. It can spread to every part of the body. And that is when it becomes really very dangerous and terrible. But at that point of spread, there is no cure. But the good news today now, no remedy, is that breast cancer is curable.
Curable.
It detected early.
Okay, let me go to Dr. Mary now. Breast cancer, is there any symptoms? Let's look at the causes first. What causes breast cancer, Dr. Mary?
Causes of breast cancer, we can't really fix it. We can't say this is the cause of breast cancer. It's actually a complex interaction because between someone's genetic predisposition and environmental factors. So when we're talking about breast cancer, what we're talking about is risk factors.
Okay.
One of them is being a woman. The fact that you're a woman, you are susceptible to having breast cancer.
You know, just hold on a while. You know, some persons out there will be wondering, no curse, it just comes like that. You know, it sounds kind of strange.
Yes, risk factors are factors that when they are present, the likelihood of someone having breast cancer is there. Okay. But we call them risk factors because we found that some persons have these risk factors, but yet they don't come down with breast cancer. While there are some persons who do not have these risk factors and they just come with breast cancer. So that's why we call them risk factors. We cannot say, oh, when you have this, yes, you must have breast cancer. So we can't talk about cause. We have to talk about risk factors.
Okay.
Being a woman, like I said, although it also occurs in men, but the ratio is 1 to 100. Where you have 100 women having it, you have just one man having it. Hormonal changes in the body, early menarche, late menopause. Actually, so we have modifiable and non-modifiable.
Let's break it down now. Early menarche. We'd like you to, at least for the purpose of those who are watching wwho are not in tune with some medical terms, I think we should break it down a bit.
Early menarche, when someone starts having menstrual flow before the age of 12 years, that's what we refer to as early menarche.
Okay.
Late menopause, when the menstrual flow stops before after the age of 55. So you have a long period of hormonal changes in the body from 12 years to about 55 years. So such persons are at risk.
Okay.
Late delivery of the first child, people who had their first child at a later age.
Like what age?
Looking at 30.
Mid-30s.
Yeah.
Yes. It's difficult to be a woman.
Well, not so difficult, because there are a lot of persons who also, that's why we're calling them risk factors.
Okay.
There are some persons who had children at a later stage and yet they do not have breast cancer.
Okay, that's some good news there.
Yes.
Okay.
Modifiable factors, weight. We have to maintain a healthy weight. Our diet, maintain healthy diet. Use of alcohol and smoking. Those are what I would call modifiable factors. That is factors that you can control, because actually you can't control being a woman. You can't control hormonal changes. Some other factors like using hormonal therapy after menopause, post-menopause, postal symptoms. Some persons have it and they now subject themselves to use of hormones. That also is a risk factor. So those are some of the risk factors.
Okay. We are talking breast cancer on ITV, and the number to call us with is 052-290-573. And for those of you who have been calling for the doctor's number, don't worry, I will definitely call the doctor's number after the program. But you need to call. I don't know how your body is. I don't know what you're feeling. You know, so whatever it is, just call. It might just be, and it might not be, but there is no harm in knowing. Okay, Dr. Lucy, how does a woman know or a man know that he or she has breast cancer? What are the symptoms?
Yeah, before we even go into the symptoms, it would be nice to actually know that breast cancer at the moment is an epidemic. Because breast cancer is the commonest cancer worldwide in women. 1 in 8 women on the street have breast cancer. Is that alarming?
And a lot may just not know.
Many of them do not even know. They don't know. Because globally, cancer is the cause of cancer-related deaths in the world. 1 in 6. It's as high as that. And over the world, we have about 14 million people presently living with breast cancer. And out of that, over 1 million die from the disease. It's even said that outside the country, 85% survive after 5 years. But it's so bad here in Nigeria that we have just 10%.
Okay, well, why
it's really
is it so
very
bad?
sad.
Is it that those of you in the medical line are not doing enough, or is the patients that are not coming to the hospital? Why?
Late presentation is a problem here in the country. Late presentation, and you won't really blame them. Sometimes the awareness is not there. They don't know. That's why we're actually here to enlighten the public. Let the public know that breast cancer is real. Breast cancer is real, and early diagnosis is key. Early diagnosis saves lives. Another issue here we have is that we don't have facilities, even for making diagnosis. Screening facilities are not that available. That's why we also appeal and call to the government to help subsidize screening for women with breast cancer. Then we have to have the need to reduce the need to pay from pockets, which prevents most people from seeking in the first place, seeking health care in the first place, because they cannot afford to pay for the screening.
That's very sad.
And it's even worse now because the age has reduced. In fact, in the country here, we're talking about 42 years being the peak age. In those days, it used to be after 50 years.
50.
But now it has dropped drastically. As we speak, we have several women who are in their 30s, early 40s, that are down with breast cancer. Very commonly now, breast cancer diagnosed in pregnancy. Women of childbearing age coming down with breast cancer. So it's really very worrisome. it's really very alarming that if something is not done on time, it will be very, very disastrous.
What's that something that should be done on time?
Yes.
So that we save our women.
Yes, to save our women.
Apart from what we're doing now, what other things?
This is public enlightenment. We're talking about breast cancer screening. Every woman from the age of 35 should have a screening mammogram done. Less than that, go for a breast ultrasound. Our women should go for screening. Then any woman that finds a lump in the breasts, not talking about the symptoms, it actually, the commonest symptom is a lump, and that lump is painless. That's why it's very deceptive, because some women feel, oh, there's a lump there, it's not painful, so why do I really have to bother myself? No cause for alarm. Any lump at all in the breasts should be removed, must be removed, compulsorily.
Is this lump describable?
Yes, it's like a walnut, you know, a seed. Actually, you call it a seed, which is very firm and could be mobile. Sometimes it's fixed. And the commonest aspect of the part of the breast you actually find is the upper outer quadrant of the breast. A fixed, hard, sometimes firm lump, which is painless.
On both breasts or just one?
Starts commonly with one breast. If not treated, it can affect the other breasts. Other symptoms that you can have are bloody discharge or any form of discharge that is not normal from the nipple. Okay. Yes. The nipple, you have a discharge. Then it calls for worry. Normally, the breast nipple is everted, which is outside. But when you have breast cancer, it now goes in. There's retraction of the nipple. There could be crusting or scaling, change in size, change in color of the breast. So when such things are happening, a woman should actually go for a check. At other times, it may not even be in the breast. Maybe a lump in the armpit. We call it axillary nodes.
Axillary node.
Yes, it could be a lump in the armpit. That's the first sign that the woman will feel.
Like a boil.
Yes, something like a boil. Some people will now want to say, yes, what if it is a boil? Yes, it could be a boil, but it's always good to go for a check. Then at other times, the breast starts to crust and it now looks like an orange. We call it pooled orange. There is dimpling in the skin of the breasts. When such occurs, then a woman should actually go for a check. At other times, this one is even very, very painful. The first sign a woman gets is a sign of spread. Back pain. Sometimes it's headaches when you have spread to the brain.
I hope it's not every back pain that is associated to breast cancer.
No, not every back pain.
Some women will begin to panic now.
Yes, there's no need for panic. Before it gets there, if a woman checks and finds out, there's probably something in the breast which she did not take note of. So she could have a spinal metastasis, a spread to the spine, liver metastasis to the liver, she could have to the lungs. So that is also really very bad because at that point, it's already a stage 4. So early detection, if women go for routine screening, they'll get to find out that possibly there's a lump, which if they remove, they can be treated and will be well. At stage 0, treatment is 100% curable. Okay. Stage 1, 98%. When you go down to stage 2, you're talking about 86%. By the time you get to stage 3, we're looking at 56%. And by the time you are getting down to stage 4, less than 20%. So it's really very sad that our women do not come early when they have these symptoms.
All right, Dr. Mary, let me come to you. We've heard everything Dr. Lucy said. Now, a woman has back pain, or maybe no lump at all, and there's discharge. What is that woman supposed to do? Run to the hospital?
Yes.
Or stay at home?
It's supposed to run. That brings to 4 one of the signs and symptoms I just want to mention. It could just be an eczema, a discoloration.
Just an eczema?
That, yes, there may not be a lump. That's a very severe type of breast cancer. We call it Paget's disease of the breast. That type is only 50% of persons that actually have a lump. Others do not have. So such women might even buy creams like antifungal creams to begin to use. So if you now don't get to the point of someone having a discharge, the person should go to the hospital. Like she mentioned, a lot of persons are coming down with cancer at a very early age. There's a very important risk factor that I will also want to mention: mutation of genes. Breast cancer genes, we call them BRCA1 and 2, breast cancer genes 1 and 2. It's not the person's making, actually. I told you it's a complex interaction between genetic makeup and environmental factors, such that this person have this predisposition risk factor, genetic risk factor. Such persons, they come down early with the disease. If someone has a lump, you just go. Now, it's not all lumps that are carcinogenic, but you should see your doctor to be sure that the lump there or the swelling there is not carcinogenic.
Okay, so there are so many women out there who do not like going to the hospital. I don't know, for whatever reason. But you find a woman who wants to keep money. You know, she keeps spreading money everywhere, saving them. But when it comes down to something as small as slight headache, she doesn't want to spend money to the hospital. Why are you women like that? You know, very tight-fisted when it comes to money.
It's unfortunate. I remember when I was growing up, there used to be this group of women. They are regular, on some days of the week, they go for these association meetings. They wear very good clothes, well dressed. But when you come to the houses, the children they left behind in the house, they barely have food to eat. Then you will now begin to wonder, this woman who is well dressed, saved so much money to buy. There was Hollandis then and single. That's the name of the clothes they used to wear. But how come the children are looking emaciated, looking malnourished? I think it's misplacement of priorities. And it shouldn't
Not necessarily poverty.
No, I don't think so.
Misplacement of priorities. Like you said, they save up money, but wouldn't want to take care of themselves or even their children.
Even if they want to, they do herbs.
Yes, alternative medication. Yeah, that's another.
How effective is that?
Well, initially it appears less expensive, but in the long run, it's actually more expensive. That's what they don't know.
So I think we just appeal to women out there, even to their husbands, to please encourage them. When they have any symptom whatsoever, no matter how mild it may seem like, they should present to the hospital. And also to modify lifestyles. Because we're talking about protection. What are the protective things that can keep one from breast cancer? One of them is when women give birth to their children at an earlier age. We're talking about 30 years and below. It's a protective factor. Women that breastfeed. Because women do not want to breastfeed.
The breast should not fall now.
It's not all about the breast falling. It's even about the child and you.
Okay.
Breastfeeding protects the mother and also protects the child. The child gets good nutrition, comes down less with things like gastroenteritis, diarrhea and vomiting, and the mother is also protected because she's protected now from having breast cancer. So breastfeeding is very, very important.
You know that there are some women who don't lactate well.
Yes.
They tell you they don't have enough breast milk.
Yes, we know that we have women like that who do not lactate well. We still encourage them, the little they can do, they should go ahead doing it. They should not just feel that because they cannot lactate well, they will not even bother at all and go for
cancer.
No. Like Dr. Mary just said, these risk factors, some women do not have it and yet they come down with breast cancer. And some have it and they still do not come down. So lifestyle modification, environmental factors, is a very complex interaction. Lifestyle modification is also very important. Healthy diets, eating of vegetables and fruits, rather than refined, packaged poisons, we'll call them.
You know, young ladies of nowadays, when they want to eat, is the refined foods, packaged foods that they want to eat.
Yes,
You know,
the one is in a rush.
Eating normal good food is like, this one is not a babe yet. You understand what I'm saying?
But do you know
so
that
food really contributes to this?
Yeah, do you know that back in the rural areas, they hardly have some of these things? Reason being that they eat fresh food or fruits, vegetables from the farms. But those things are very fast leaving the scene. Now everybody wants to go to the Western diet. And Westernized diets could be poisonous.
Well, you see, when it comes to food and fruits, these days we're not even safe with all the genetic modified foods that we have.
Yes.
Somebody's planting cucumber, there's something added.
Yes.
Somebody's planting tomato, there's an enhancement.
Yeah.
How do we now check for all of this?
Well, that's why we also have NAFTAC and some other people there who can also help for that.
How effective that sector is, we will see sometime on this program.
Okay.
Okay, so let's go on.
So like we're just talking about one major reason why our people here come late is because they don't have money. Some of them don't have money to pay for their health care. And even when they go to the hospitals are short-staffed. Because presently in the country, a lot of doctors are leaving. So those are some of the factors we also want to look into. We're having a lot of brain drain. We don't have enough even people to take care of the ones that are there. Those in the rural areas, they are almost completely left out. So these are the things that we should actually do to help our women to prevent breast cancer. Advocacy is really very important. Then also another preventive method is also the use of the good exercise. Exercise. You know, women do not go for exercise.
No, we feel that after sweeping, mopping, doing all of that chores,
no,
you've sweated,
we're talking of deliberate exercise. Taking a walk. You know you are doing it for a purpose. Doing some good aerobics. 30 minutes of exercise, like 3 times in a week, will not only prevent breast cancer, it will also prevent other diseases, like some cardiovascular diseases and some other diseases. Breast cancer, exercise helps to prevent a lot of diseases. Then, we'll not talk about breast examination. Breast self-examination. Every woman should examine her breasts.
Okay, before we go into that, let's quickly roll our number again. The program is Healthy Living and we're looking at breast cancer. It is very important that you go to the hospital whenever you see any signs. The doctors are here seated, eager to answer whatever question you have to ask. And the number is 052-290-573. Call in, ask the doctors. Don't wait until the end of the program before you start calling. By then, it might just be late because I'm not a doctor. So the doctors are here. Please call in to ask them questions. All right, doctor, examining the breast.
Yes, that's the basic that any woman can do. A breast self-examination at least once in a month. Menstruating women can do it 5 to 7 days at the beginning of their period. Then for others, they take a particular day in the month where they do the examination. Okay,
let me come to Dr. Mary. Now, how do you examine yourself? Do you just go press and, okay, no lumps, you're done? Is there a particular way, is there a systematic way that a woman can employ, which a woman can employ to like check the breast? You know, because some of us just beat, just check, okay, nothing, I'm good.
First of all, like she rightly said, it's good you do it within the first week of the beginning of your menstrual period.
Okay.
You stand in front of the mirror.
Okay, let me pause you. Let's take this call. Hello, caller. Good afternoon. Okay, tell us your name and ask your question, please.
Hello.
Okay. Sakola, go ahead. Okay, reduce the audio level on the television set, please. Or you move away from your TV set. Hello? All right, we lost that phone. Hello? Sakola, could you please move away from your television set? All right. Hello?
Hello? Hello?
Hello, move away from your television set or reduce the audio level so that we can hear you. Are we good? All right, callers, when you want to call us, try and move away from your television set or reduce the audio level on your set so that we can hear you. There is no way your audio level will be so up and then let's hearing you. Hello.
Good afternoon.
Good afternoon. Please reduce the audio level on your television set.
Hello.
Hello.
This is me.
Okay.
Calling from automation.
Can you reduce the audio level on your TV or move away from there, please? Are we good now? Okay, hello?
Yes.
Hello?
Hello.
Yes, we can hear you.
I have a friend
Okay.
whose one breast is bigger than the other.
Male or female?
Female.
Okay, one breast is bigger than the other.
Is that symptom of breast cancer?
Okay.
Okay, size now.
No,
all right.
Normally, one breast is normally bigger than the other.
Okay.
It's when it's now, you know you know how your breasts are. It's something you have been seeing. So if it has been like that, no problem. But if you now notice that it's now unusually big than before, that's why you now raise an alarm. So that the breast is one is bigger than the other is not breast cancer.
Okay. All right, doctor.
Hello.
Looking at examining. Hello.
Hello.
Hello. Good afternoon. What's your name, please?
Jasmine.
Good afternoon. Tell us your name.
Okay.
Okay. Can you reduce the audio level on your television? Please call us. If you do not reduce the audio level on your TV set, we will not be able to discuss. We will not hear your question. And it will be making very, painful noise in the ear. So just reduce the audio level on your TV set or move away. Go to another room and ask your question, okay? All right. Hello? Hello?
Good afternoon.
Good afternoon. What's your name, please?
Yeah.
Okay, Vera, ask your question.
I'm fine. I'm feeling a pain at the upper side of my breast. I think it's a symptom of cancer.
You're feeling pains?
Yes, at the upper side of my breast.
Upper side of your breast?
Yeah.
Okay, so what do you want to know about that?
I don't know if it's a symptom of cancer.
Is it a sign of breast cancer? Okay, doctor.
So not all pains are signs
Hello?
of breast cancer. In fact, breast cancer lumps, usually they are painless.
Okay.
The woman may just come with maybe a burning sensation or itchy, especially if it's the type, like I mentioned before, the Paget disease of the breast. But usually they are painless. But that doesn't mean she shouldn't go and see a doctor. Because one of the risk factors is when someone has a history of breast issues. When I mean breast issues, maybe inflammatory diseases of the breast, which are usually initially not cancerous. These pains, these lumps, these are some of the risk factors. So it's good when you have any issues in the breast, you see your doctor. Don't do
Is breast
self-examination.
cancer hereditary?
Oh yes,
Yes, that's what
positive
we're
family
trying to say.
history. Positive family history is one of the main risk factors to breast cancer. A woman that has breast cancer, her mother, her daughter, her sister, we call them the first degree relatives. So if in your family somebody has breast cancer, it's good that members of that family should start screening at an earlier age.
Okay.
It's even said that breast screening in the blacks should be, even those that are going for screening, should be 10 years earlier than the Caucasians.
Really?
Yes.
Why so? Because we're black?
It's racial, genetic. So we have to go for screening earlier. Then if you have it in your family, you should go for your screening early.
Okay, we'll take this corner. Hello, good afternoon.
Yeah, good afternoon.
Please tell us your name and ask your
My
question.
name is Joseph. My question is, how do we detect the breast cancer? What are the early signs or symptoms that we're able to tell us that somebody is having breast cancer?
Okay.
Hello?
Hello, we can hear you.
Yeah, what are the symptoms, the first symptoms, that will tell us that somebody is actually having it?
A painless breast lump is the commonest symptom. A painless breast lump is the commonest symptom. It's when it now gets advanced that you not have pain. But when it's starting, like he's asking, early sign is a painless breast lump.
Okay.
It could also be a discharge. It could also be change in the skin of the breast.
Okay, you talked about, sorry doctor, you talked about breast cancer in men. What are the symptoms? How do you know?
It's actually a rare disease, but basically they are the same symptoms. You have a lump. Yes, the breast of the male is small, but you could feel some nodules there. You could feel some lumps there. Then a male ought not to have any discharge. But right now it's having maybe straw-colored discharge or even a bloody discharge. Basically, breast cancer is breast cancer. Breast is a tissue, whether in the female or in the male.
Not necessarily whether it's big or not.
No, the
not
size.
the size. Just to add to those person asking the early symptoms. Like we were talking about, yes, our attitude towards our health care, for those who would have the money but they wouldn't want to do something, and for those who genuinely do not have the money, mammogram would have helped pick it. Because there are some changes in the breast tissue, the cells, that the ordinary eye may not be able to see. Because by the time you start even seeing a seed, it has been there for quite some time.
Okay, for the women, how do you know? Is the lump visible or until you touch?
Do you know that if you...
When you touch.
Yes.
When you touch, it's not as if it's visible.
No, but you know something. You know as you are, normally. There is this instinct in man. And when there's something wrong somewhere in part of your body,
Yes.
you will go there. Your mind will go there and you feel it. So if there's a lump in the breast, many times, your instincts will get there that there's something here. So many times, people will always know. It's not too common that you have something strange in your body that you will not know. People will always know.
Okay. Hello, caller.
Hello.
Good afternoon. Hello.
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 Hello. Good
Kindly
afternoon.
reduce the audio level on your TV set, please.
Hello. Good afternoon.
Yes. Good afternoon.
This is Bridget calling from Ekiti.
Oh, nice to hear from you, Bridget. Can you ask a
Okay.
question?
I actually discovered a lump in my left breast. That was 2016.
Bridget.
2016. So I went to the
Bridget.
hospital last year.
Bridget, can you hear me?
For checkup. They
Bridget.
actually did an ultrasound. The lump was so it was a fifth lump anyway and very strong. They did an ultrasound. They told me that it's not cancerous, that it cannot lead to cancer, but the lump needs to be, that they need to remove the lump. Hello, can you hear me?
Yes,
Yes.
we can hear
Yes.
you.
Okay, okay. They told me that they're going to remove the lump, but out of fear, they said it might lead to cancer later. But they said I might also go on its own. That was what they told me. They said, but out of fear, we should not leave it, but we should just take it off. But I was so afraid to go for operations. So I said, okay, let me wait for some time. Let me see if this thing can go on its own. But after some time, discovered that it's no longer there. I'm no longer feeling the lump that I was feeling there. Because it was a fifth lump and very strong at my left breast, at the upper region. But later I discovered that it's no longer there. But I don't really know what happened though. But I just believe that maybe it's a miracle. I don't really know what happened. But it's no longer there.
Okay.
Yeah,
All right, doctor.
she's one of the candidates that should go for frequent
That is
routine
it.
examination.
Okay.
Because she already has
A history.
risk factor, a history of breast issue, like I mentioned earlier. So she shouldn't just leave herself.
But the
on a
lump is
regular-
not there.
Yes,
She said the lump is gone.
Yes, it's gone. But she need to, depending on her age, if she's less than 40, she should go for a regular ultrasound scan.
Okay.
If she's above 40, once in a year, she should go for mammogram. So be sure that that has actually done, is not undergoing any cancerous changes.
So Bridget should not ignore anything.
If I would call
or let
them, we
anything
call them
go.
warning signs. We don't ignore warning signs. And
Okay.
it's also an appeal to many people, because many of us in this part of the world, we are faith-based anyway, and we just believe things happen and they come and they go.
Yes.
Please, we're appealing. People should still go for regular screening. This lady particularly should please go for screening.
Okay.
It's okay, fine, what she has said is very good, but she should not just ignore.
Okay. So Bridget, please don't ignore the warning sign. Go do breast check. She goes for.
It depends on her age. We've said that
okay,
if she's
on your
less
age.
than 40, she goes for a breast ultrasound. But she's above 40, she goes for
Is
a
it possible for her
mammogram.
to do both?
Yes, yes. When you go
Okay,
for a mammogram,
so-
you can do both.
All right, if you can afford it, please do both to be on the safe side. Hello, caller. Good afternoon.
Hello.
Hello, lady. Good afternoon. What's your name, please?
Yeah.
Can you reduce the audio level on your TV, or you move away completely from that room?
Okay, I said it's Jasmine.
Okay, Jasmine.
Yes. What are the symptoms of breast cancer in an early stage?
Ask your question again. Reduce the audio level on your TV set, or move away from there.
Okay, I said what are the symptoms of cancer in an early stage?
Okay. Early signs of cancer, of breast cancer.
Yes.
Early signs of breast cancer, doctor.
These are the things we have said over
I'm
and
sure she
again.
Just tuning in.
start with us. I'm sure she didn't start with us.
We told you about lump on the breast, a kind of tissue that is thickened. If I may break the word lump down, and on the breast, that's a sign. And I also said that if you go for mammogram, there are some things that the ordinary eye cannot see. Tissue changes, the cell changes that the X-ray can pick, such that it may even get up to 4 years before the ordinary eyes and the ordinary hand can feel the changes. So the early signs, X-rays, early signs,
Okay.
and then the physical early signs that you and I can see. And those are the things we measured: a lump in the breast, a thickening that is unusual, that is different from the surrounding tissues of the breast. Discharge, maybe straw-colored discharge, bloody discharge, nipple inversion, as in what something that's supposed to come out is going inside. Then some dimpling in the breast. We call it pudorrange, just like orange is. You see the dimpling in the breast. It could just be an eczema. That's a very dangerous one, because that there's no lump. You just have an eczematous skin lesion, and you say, "Oh, this looks like a fungal infection." You go out there, buy it. Then it has even gotten to a late stage. Even if you feel the breast, you won't feel any lump.
Okay, doctors, while we're talking, you talked about breast cancer in pregnant women. And it really got to me. A pregnant woman with breast cancer, how is she going to manage?
Yeah.
What's she going to do?
Yeah, many times some women, their breast cancers are diagnosed in pregnancy. Could be early pregnancy or late pregnancy. This time around, we now have to discuss how do you want this to go, because what happens in pregnancy is that many times they cannot take treatment.
Because of the
Chemotherapy,
baby.
yes, chemotherapy, radiotherapy, they may have issues having their treatment. So at the end of the day, it now looks like it's worse in them, but it's actually not supposed to be. But because they are not able to take the treatment, and also the fact that many of them may not even know on time, because during pregnancy there are changes in the breasts. So these physiological changes might be thinking is what has happened, not knowing that we are already having some pathological changes. So they come sometimes late. But even when they come early, we are now at a dilemma concerning their treatment, and that actually slows down the treatment. So when they come, depending, like I had a patient who came at 6 months, a precious baby. So we had to call in the gynecologist who helped to take her to term, and she delivered. Though she had to take her drugs during pregnancy. She had to
And those
sign.
drugs will not affect the baby.
The drugs may not affect the baby.
May.
Not affect the baby. So there are a lot of things we have to weigh. So when she comes to the hospital, we actually discuss and we have to weigh. Sometimes benefits outweighing the risk. We go ahead, or vice versa.
All right, in the course of the program, you did say that early detection can be cured if you detect it early, that this is breast cancer. What are these curative measures?
Early detection, we say, is key And like we said, if you go for a routine mammogram, you've not even had a lump yet, you are just going for screening, and it's detected at that stage that there's a problem, then surgery will be done. You can remove the lump, and any other form of treatment that you will need to be given to you. And the patient is fine and doing well.
Okay.
So when they go early, when it is found early, even when it's already breast cancer, that even when it's a lump that you can feel, and it's still very small, less than 2 centimeters, that's stage 1. A patient can be treated and she'll be cured. So early detection is key in all. If it is found early, then the patient will be treated and be sure that she will be fine.
So at what point is the breast removed? You know, like you do a surgical operation to like remove an affected breast, or maybe both?
Yeah, like we said, in this part of the country or in this part of the world, people present late. But if they present early, there are options, different types of surgeries that can be done. It could just be removal of the lump alone. Or when we now see that the patient is going to benefit more from a more invasive surgery, then they can remove the breast in total, which is called a mastectomy. So all those depends on when the patient presents, how the patient presents, the stage, and all other things that are put together. It's just not one decision that is taken, but a lot of factors, multifactorial, are put together to take a decision on the kind of treatment that the patient would have that will benefit this patient.
Dr. Mary, when a woman has had maybe one breast, maybe one breast removed, or both, what kind of life is that woman going to live after that, with chemotherapy and all of it? Will she be able to live a normal life?
Yes. And again, it has to do with the psychological state of the woman. Okay? That both breasts are removed.
Or one.
Or one is removed. Isn't the end of life? Some persons even do what we call preventive treatments. They have the risk factors. The doctors tell them, oh, there's a family history, their sister, their mother have breast cancer, and maybe they go for screening and they found out there are some changes in their genes. They haven't gotten breast cancer yet, but these genes, they predispose them to breast cancer. Where things happen among Caucasians, they just go ahead and do preventive surgery. They ask elective surgery, they remove both breasts. And they live normally.
The kind of people that we are. Okay. What kind of life would that woman have?
Please, the issue of quality of life when it comes to breast, because I have a lot of patients that have had a mastectomy.
Yes.
You won't even know. The woman might be on the street walking. Many times after the mastectomy, they get a prosthesis. Okay. With a prosthesis, it now fills the gap. Where there's a space, it fills the gap, and the woman is normal. She's nobody has to know. Nobody has to know. She's living her normal life. She works in the office with you. She's doing her things normally.
If
so nobody has to know.
Who have not had children before.
Yes.
With the chemotherapy, the surgical process and everything, would that woman still be able to have children?
Yes, she will. After 2 years of treatment, she can have children. Yes, she will. We have a lot of them. A lot of them.
The chemo will not destroy anything.
No. The chemo will not destroy it. After treatment.
But we told that it will remove your hair, it will take a lot of
anything that happens when you are taking chemotherapy, after the chemotherapy, it's reversible. The hair grows back. If the hair falls off, it grows back. Sometimes your nails are dark, it gets cleared. So whatever they are having, that harsh in quote now, that they are having during treatment, all goes down after the treatment, and they live normal lives. That's why we are saying people should not run away from the hospital. When you have a problem, please present. If you come early, you are treated and you live normally. We have people who have been treated for the past 10 years, 15 years, 20 years, 25 years, still counting, and they are very, very good.
So what are the myths surrounding breast cancer as we round up now?
Yeah, there are a lot of myths surrounding breast cancer. What are myths? There are things that people say that are not true. Because there are a lot of things you hear people telling you at different points, a lot.
Let me just tell you one. After the program on Thursday, a man called to say that the wife does not allow him play with her, touch her breast, suck her breast, because she says too much of it might just give her cancer of the breast.
Okay, that's even the first one now. One of the first myths about breast cancer is that touching the breast often will not lead to breast cancer. Rather, it will even help to detect it. Because when you feel and
it's
touch
not complaining
it,
about just touching, including sucking of the breast too.
sucking of the breast is protective. That's what we say. Breastfeeding is
Really?
yes, breastfeeding is protective.
Not for the baby, for the man.
It's protective because when you are sucking, you will be able to feel that there's something there.
Okay.
So you'll be able to.
Help the woman.
Yes, many times our patients is the men that help them to make that diagnosis to say there is something in your breast. Many of my patients is their husband that actually detected it.
That's lovely.
So touching the breast often will not lead to breast cancer. Talking about breast cancer as we are talking now cannot lead to breast cancer because the people just like, no. Like you said earlier on, if you don't want to hear about the breast, maybe you should tune off.
God forbid syndrome. It's not my passion syndrome.
Yeah, so you don't even want to talk about it. But I can tell you, ignorance is not anything for anybody. When you know, information is key. It will lead to you being deformed. So when you know, you'll be able to know what to do. So talking about breast cancer will not lead to breast cancer. Like somebody sitting beside you that has breast cancer, it's not infectious. It will not get to that person. Okay. That's another myth. Some people will tell you, this person has breast cancer, I'm running away from the person. No, it's not airborne. It's not infectious. A bruise or a wound in the breast from whatever cause cannot lead to breast cancer. Maybe there's an injury to the breast from any other cause. It will not lead to breast cancer. There's also herbs. When they have made diagnosis of breast cancer, they'll begin to take all sorts of concussion here and there. We have had people who have gone, they go to take concussion. By the time they come back, they are coming back in stage 4.
Is it that the concussion don't help or does not work at all?
Well,
does it not even give any relief?
We are scientists, and well, we talk of whatever we do is based on findings and studies. Okay. I don't know any yet, which is this particular one is what we hear. Where some people talk about, fruits and vegetables, fine. So I would say soursop water, soursop drink and all that. Beautiful. For someone that does not have cancer, they are herbs. They are good. You can use them. Anything herb is good. But when you now have a diagnosed disease, the patient has breast cancer, that's not the time to begin to go take all that. You come to the hospital and be treated. Then some say, when I go for tests, and people are talking about tests, mammogram, ultrasound. If we go for a test, won't we have breast cancer? No, they don't lead to breast cancer. Then they say, okay, breast cancer affects only older women. That was in the past. Not anymore. We have people that are in their 20s. As I speak, I said most of the patients now we have are between the ages of 30 and possibly 45. 42 years peak. So it's not all about being elderly anymore. Some say use of anti-deodorant and all that will lead to breast cancer. They are all,
I've heard that too.
Yes, there are things that people just, documentations are the key here that we say, okay, no. Then another very important one is that a breast cancer diagnosis is not an automatic death sentence. It is not an automatic death sentence. Breast cancer is curable if detected early. Early diagnosis saves lives.
Dr. Mary, for the purpose of emphasis, please, can you just hammer on the kind of food we should avoid?
Well, like I said, there is no food that will say this causes breast cancer. But it's advocated that we take vegetable-based foods, fruit-based foods, fish-based foods as against meat, and then vegetable oils as against cholesterol. Healthy diet generally. That is the key.
Okay, and somebody will want to know how to really check, especially for those who do not have husbands that will touch them. At least self-examination once again before we round up.
Breast self-examination,
So
you stand in front of the mirror.
Okay.
You put your hands on your hip with your shoulders head high.
Okay, like that.
You look at the breast. First of all is inspection. For size, for shape, for the color of the breast. You find out whether there's something different from the usual. How has it been? And it's when you do this regularly, you will be able to notice that there's a change. When you finish doing that, you remove the hands, put them above your head. And then you also inspect for the things I said we
using your mirror.
We're
not talking about hand mirror now. Look for a
standing
mirror
so you can see yourself. After inspection, before you now come to the touching, you use your left hand for the right breast. And
the touching, how do you touch?
Yes.
Do you just
I'll come
squeeze,
to that.
squeeze,
No,
squeeze?
no. You use your right hand for the left breast and the left hand for the right breast. You do it systematically. You put the pops of your fingers together, so it forms a flat surface.
Yeah.
You start systematically. You can start from the middle, around the nipple, around the areola. You start with a light touch, a light press, a light pressure to be able to feel if there are changes in the surface tissue. Then you go further, a harder pressure for medium pressure for tissues in the middle. Then you now go deep, a harder pressure. At this time, your hand should actually be touching your rib cage because there's something deep down that you need to feel. Then you go systematically. You can start from the upper outer quadrant. You go like that in a cycle. Like
and in all of this, you must be patient with yourself.
Yes. You go in a cycle, just like this, like you're rubbing something, not necessarily pressing. You're as if you're feeling, you know how to feel for something, you go systematically. So you don't miss out any quadrant. Outer, upper, lower, outer, then you come, middle, medial, lower, then up, and then you come back, you feel around your areola. You do it for both breasts. Then, when you finish doing that, when you're standing or sitting, you can also lie down and then do the same. Basically, when you do this, you'll be able to feel if there's any lump in your breast.
And to just conclude on that, you now squeeze. You now have to check the nipple. You squeeze. If you don't have any fluid, could be bloody, could be straw-colored, yellowish, or whatever discharge. When you squeeze and you find nothing there, at least you know that yes, you are true with the breast
even with all of that,
self-examination.
it is still advisable that you go do a breast scan or you go for
a breast self-examination, a clinical breast examination, which you go to the hospital and the health worker helps you to do that. Your doctors, your nurses can help you to do your examination. Then a screening mammogram or an ultrasound, depending on your age. If you are less than 40 years, you go for a breast ultrasound. Or if you are 40 years and above, you go for a screening mammogram.
And if possible, you do both, right?
Yes, you can do both. If also you can do MRI. MRI can also be done to find out if there's any lump. So we're actually appealing to our women, especially, to please go for screening. This is the pink month, October, which will be rounding up tomorrow.
Pink.
Yeah, it will be rounding up tomorrow. So every woman should please make sure they are screened.
All right, for those of you who have been asking for the doctor's number, you can give her a call on 081-2788-6846, 081-2788-6846. All right, ladies, thank you so much for being part of us on the program Healthy Living. And I want to believe that you out there got some information and some education. In case your wife did not watch, please tell her. And in case your husband did not watch, also inform him, because no information is lost. We'll see you again next week. Until then, be health conscious. Goodbye.